Live started. Okay, okay. So done. So can I start now? Yes. Okay. So hello all. So is everything clear? Audio, video, everything? If yes, I'll start then. Screen, audio, video. Uh, can someone let me know in the chat box? Is everything clear? If yes, yes, yes. Okay, okay. Yeah, we'll start then. So here we have like a quick recall of all the INI-CET May 2025 pharmacology questions now. So yes, yes, clear. Then that's fine. Thank you. So here I said totally almost around 18 to 20 questions were there from pharmacology, 18 to 20. It's always expected around 20 questions, around 20 questions. So here, as I always tell in the class, before starting my class, I always show the statistics of like how INI-CET people focus on the chapters. So this is what I always shown like before starting the class. Before starting the class, in INI-CET, I always mention antimicrobial agents, CNS, general pharmacology. These three are the key heroes from the past 7 years. From 2018 to 2024, these are the three we have like a maximum number of questions. So I always tell in INI-CET, these three will be the key heroes. And again, the same thing proved now also. In this May 2025 session, the same general pharmacology, CNS, antimicrobial agents, combining these three, almost 50 to 60% of the questions only from these three, what you call chapters, only from these three chapters. So we'll see what are all the questions asked there, and we'll have a quick recall session. Nothing much. It's not just a class that we are not going to explain in detail. We'll just go through randomly what are the questions asked, what's the correct answer. So let's see it now. So the first question: which of the following statements about the phase one metabolism? Which of the following statements about uh, this phase one metabolism is true? That's what the question asked here. Phase one metabolism. So this already we discussed it in the class. This clearly I mentioned phase one oxidation, reduction, hydrolysis. These are the things which are going to happen in phase two. So some conjugate will come and attach to that product of phase one or maybe the xenobiotic. So finally it will get eliminated out. So clearly we have mentioned oxidation, reduction, hydrolysis. And in class, I clearly told this is a previous year question. The same thing repeated here again includes oxidation, reduction, and hydrolysis. This is for the option, and this is what like a phase two part. And this is not a correct one, and we are not converting it to enter into this. We are making it to eliminate out. We are just eliminating out. This is also not the correct option. So the first option will be the correct answer. So again, yes, yes, Arun, that's true. Option A, option A. It's always there. It's already mentioned in the notes. Direct question from the notes. Ditto, as I always mention. So now let's come to the second one. Second question, he has asked the statement here. He has asked about these match the following part. So he has asked something about cross tolerance, acute tolerance, and reverse tolerance. These are the three statements he mentioned, and he gave like three definitions, and he had to match the following. And this is what again it is present in the notes. In pharmacodynamics, it is again there. Tachyphylaxis, tolerance, reverse tolerance. It's already mentioned in the notes. So cross tolerance, so tolerance to one drug leading to tolerance to other drug of same class, or like a similar mechanism. That is what correct answer. And this is what like students may get confused between acute tolerance and the reverse tolerance. Acute tolerance, it is what acute, rapid decrease in drug response. And reverse tolerance, it is like increased drug response. These are the correct answers for these cross tolerance, acute tolerance, and reverse tolerance. Again, from our notes. Again, from our notes. So that's all about the second part. Now come to the third question in general pharmacology. And I think majority of the students, they might have fell into the examiner's trap here. I always tell in the exam, INI-CET, it's all about easy questions with the tricky options. The same thing happened here. So He is asking which of the following is the critical factor in determining the oral loading dose. So majority of you, can I see what you call options? Like, can I see this part in answers from students? Like, which is the correct option here? So oral loading dose, what is the correct option? If I can see it from the options, we'll see who will answer. So it's like a volume of distribution, A, B, D, exactly, Arun. It's A, B, D. That's true, that's true. It's generally for loading dose, as I told in the class, it's like log MCH. So loading dose, it's volume of distribution, maintenance dose, clearance, and a half-life. But here, yes, loading dose, always volume of distribution. And of course, this plasma concentration will always be there for what you call for both loading dose and as well as maintaining dose, maintenance dose. Oh, it's not a ABD. Sorry, Arun. It's not a ABD. It's ACD. It's ACD. Yes. Target plasma concentration. It's ACD. ACD, not half-life. Half-life it's for maintenance dose. Half-life it's for maintenance dose. So, but here, if the question says like just determine the loading dose or IV loading dose, we will not consider the bioavailability. But here he asked oral. So definitely bioavailability should be there. So this is what exact again question from our direct notes. So loading dose, I told plasma concentration to volume of distribution. I told this is what again a previous year topic too. So again ditto from our notes again. So that's all about this volume of distribution part. Like sorry, loading dose and maintenance dose parts. Now come to the next part here. Which of the following best explains the renoprotective effect of phenol dopam? So this again, it is direct question from the notes. You see, in phenol dopam, we have discussed in ANS, it has direct action on dopamine receptors. Clearly, we have discussed that phenol dopam has action on D1 receptor. It has no action on alpha receptors and it has no action on beta receptors. So clearly, it's like selective action on D1, selective action on D1. And it has no action on alpha 1. It is not a AC inhibitor and it doesn't have anything related to dopamine D2. So clearly, again, a direct question from our notes. Again, direct question. That's exactly true, ma. So again, direct question from our notes. So next one, which of the following is a specific reversal agent for rocuronium-induced neuromuscular blockade? Rocuronium, generally we know rocuronium, we go for sugammadex. But here there is no sugammadex in the option. So we have neostigmine. So again, the direct one from our notes. So neostigmine, reversal of neuromuscular blockade, all the non-depolarizing what you call agents. And clearly we mentioned for rocuronium, we use sugammadex. But this is not in the option, right? As I mentioned in the class, it is again a previous year question. All four drugs were asked in the exam. The same thing. Yes, true. It's a neostigmine. Atropine, it is not. It is for OP poisoning. Dantrolene for malignant hyperthermia. Baclofen is it's GABA B agonist. Nothing related to this part. So that's all. This is for OP poisoning. This is for malignant hyperthermia. So that's all about neostigmine part. Now come to the next one. Which are the following a first line vasopressor for the management of septic shock? Clearly, very clearly he has given first line drug, the most appropriate, the first line drug. So this is again we mentioned in the notes, vasopressor in any situation, the vasopressor of choice that is noradrenaline. It already we mentioned in the notes. So, but here, will you norepinephrine or noradrenaline? Based on the situation, we can go for addition of vasopressin. But vasopressin is not a first line drug. It is not a first line drug. It is an addition to noradrenaline. That's it. Nothing much. So here, noradrenaline. That's true. That's noradrenaline. So first line vasopressor, that is noradrenaline part. That's all. Again, that is directly from our notes. Next, here comes like I told almost like during the class I told it's almost like 7 or 8 times the question repeated in the exam. So carbamazepine combined with this erythromycin leading to dizziness, diplopia, and ataxia in the next 2 days. And what is the best mechanism of action or like best explanation for his or her symptoms. So this is what question asked, and I told you many times, if you see any drug combination with a clarithromycin, azithromycin, this is what I always mentioned in the class. Many times I mentioned during enzyme induction inhibition. Again, when I am talking about this macrolides part, so whenever we combine these two drugs, always it leads to increase it, always it leads to increase it ADRs of these drugs. Yeah, exactly. Erythromycin is fantastic. That's true. Erythromycin is an enzyme inhibitor, and it's going to inhibit increase in the carbamazepine levels. This is the correct option here. Option C. Option C, erythromycin increases. Yes. Yeah, exactly. Yes. True, Arun. Right. So, and the same thing I mentioned, I spoke at enzyme induction part two, and again I spoke here also during macrolist. I gave the exact thing, either clarithromycin, azithromycin, or digoxin, carbamazepine, theophylline. So he has given in the question, he has given clarithromycin, and he spoke about this carbamazepine. The ditto one from our notes again. Direct question from our notes. So coming to the next part again, which of the following anti-epileptic drugs is most strongly associated with neural tube defects during pregnancy? This is the question again. It's a very direct question. Valproic acid. I always tell in the class, uh, in CNS chapter, as I always tell, in three general pharmacology, CNS and antimicrobial agents. In CNS, definitely like few questions are like 4 or 5 questions will be there. In those 4 or 5, definitely questions will be from what you call anti-epileptic drug. I mentioned very clearly, and this is a first question. This is a first question, carbamazepine part, and then this is the second question. So again, stats always like that's the reason why I mentioned always these statistics. You should never miss these topics. So valproic acid, fantastic. Valproic is a teratogenic drug, and lamotrigine, levetiracetam, they are the most what you call safest drug. Again, direct from our notes. Direct from strongest association is valproate, and the least association, which is a bit safe comparatively other anti-epileptic drug, that is lamotrigine and levetiracetam. That's what. Nothing much here. Again, directly from our notes. The next one. Which of the following agents are used in the treatment of acute mania? Again, this is a multiple answer question. So here we can use valproate, haloperidol, lithium. Why we use amitriptyline? It is not a used drug. It is an antidepressant. We don't use this one. So these three are the correct. These three are the correct answers here. So again, this is also directly from our notes. You can see in the mood stabilizers, we discussed it, this part, what are all the drugs used as a mood stabilizers. And in here also in acute mania, haloperidol, I told you this is a previous year question, haloperidol. The same thing repeated this year also. The same thing repeated this year also. So that's all about this part, acute mania. So valproate, haloperidol, and lithium. Now come to the next one. So depression, doctor prescribed imipramine, and she's taking diphenhydramine. So which are the following drug interaction we can expect? We can expect imipramine with a diphenhydramine. We know this imipramine is a tricyclic antidepressant. It has several properties. It is going to have like alpha 1 blocking property. It has a muscarinic blocking property. It inhibits serotonin receptor. It inhibits serotonin reuptake part, and then uh, serotonin transporter, norepinephrine transporter. It is going to inhibit all. It is going to inhibit all, and it has anti-muscarinic property too. The same thing, diphenhydramine. Clearly, we mentioned this diphenhydramine. Yes, exactly. It is going to block the muscarinic receptors. So in our notes, clearly we mentioned diphenhydramine. Diphenhydramine is an anticholinergic along with antihistamine. So it has anticholinergic properties, and imipramine also has anticholinergic properties. So it is going to block the muscarinic receptor. This is a single best answer here. This is not like a single answer. This is what single answer. It's not a multiple part. So that's all. That's all about this imipramine and diphenhydramine part. So again, here asked like identify the correct statement he has asked in the exam. So benzodiazepine barbiturate, they act as a GABA A chloride channel agonist. That's true. And benzodiazepine with alcohol, yes, both are CNS depressants, and is going to increase that CNS depression part. That's true. So, but here, flumazenil, it is a barbiturate poisoning antidote. No, why it will be the barbiturate poisoning antidote? Clearly, this is mentioned in our notes. Like flumazenil, I told you many times, like in leaderboard, we have the same question. So, flumazenil, it is an antidote of benzodiazepines. Barbiturates, there is no antidote, only the symptomatic treatment we used to do. That's all. That's also it is not C is not a correct option. A and B. And can if anyone no antidote exactly Arun, there is no antidote. There is no what you call antidote. True. So just only A and B. There is only A and B. So that's all. These are the two. And I don't know what is the D option. If anyone can recall the D option about this part, you can just mention in a chat box. So that's all about this benzodiazepines barbiturates part. Now come to this question: which of the following prostaglandin analog is used as a oxytocin? But it's not. I think the question. I think this not exactly. It is used not used for not recommended for this management of PPH. I think so. I think this is the only question they have asked, but I'm not sure exactly. If you can recall, you can just mention in the chat box. So here, dinoprostone. Clearly, we mentioned in our notes, dinoprostone. It is a gold standard one for cervical ripening. Dinoprostone. It is for cervical ripening. Yes, exactly. So again, here the answer is dinoprostone, not used for PPH, dinoprostone part. So that's all about that. And now here comes again. This is an exact question like a NEET 2024. NEET. Oh, correct question only, ma. That's fine. Okay, that's fine. So NEET 2024. This is an exact question. I still remember NEET 2024 afternoon session question. This is a ditto afternoon question. Ditto question this was. So 25-year-old sexual active male, like I told you, if you get these kind of very lengthy kind of questions, what you should do? Start reading from the last line. Which of the following is a most appropriate treatment? So we already understood what is the climax. So he's asking the treatment. So he mentioned patient is allergic to penicillin. Okay, now go to the next one. So it shows intracellular gram-negative diplococci. Gram-negative diplococci, classical one, gonococci. It is gonococci. So clearly next he mentioned unprotected sex intercourse and history of purulent urethral discharge and dysuria. So classical features of gonorrhea we know is ceftriaxone, ceftriaxone. It is a answer here. But students they might have confused like patient is allergic to penicillin. Yes, he when a patient is allergic to penicillin, and he might show some allergic to but the first generation cephalosporins, but a very rarely to third generation cephalosporins. Exactly. Gonococcus. Correct, Ma Kavya. Correct, Arun. It's gonococci. So answer is ceftriaxone. Answer is ceftriaxone here. It's a but so as I mentioned, this like a what you call a repeated question, direct repeated question from NEET 2024. So that's all about this question. Antimicrobial agents we have done with this for ceftriaxone. Now come to this one. As I mentioned, this gonorrhea, ceftriaxone. I told you that is the previous year question. The same question. Question repeat. It's not even topic. It's a question. So now come to the next part. Which are the following drugs used in clinical cure? Clinical, again, it is a multiple thing. So Primacan, why we use Primacan for clinical? It is for radical cure. It is for radical cure. So these three options, A, B, and D, A, B, D, and D, clinical cure of malaria. So this is what I repeated multiple times in the class. If you are reading malaria, concentrate on this page. So that's what I mentioned. This whole 210 page. Concentrate on these drugs. Concentrate on these drugs. I told I told you this clinical cure. It is a previous year question. Radical cure. It is a previous year question. So he asked about this clinical cure. Radical cure. We have only Primaquine, Tafenoquine. Other all the drugs are used in clinical cure. Again, it is a direct question. Direct question. This is. So artemisinin, chloroquine, sulfadoxine, and pyrimethamine. So Spironolactone is not used. So A, B, and D. I mean to say options I they might have interchanged in the question. So these are the artemisinin, chloroquine, sulfadoxine, pyrimethamine. These are all the correct options here. So that's all. That's all about this malaria part. Clear? Now let's see one more thing. Which of the following is the most appropriate management for complicated UTI? Complicated UTI. If it is like again uncomplicated one, we go for nitrofuranate. But if it is a complicated one, we go for ceftriaxone. If it is uncomplicated, we can go for this. Uncomplicated, we can go for this first line drug as a nitrofurantoin. Again, it's a very simple one. Uh, Complicated VI part. Now, D, yes, sulfadoxine plus pyrimethamine. Sulfadoxine plus pyrimethamine. That's what we mentioned here, right? Sulfonamide, sulfadoxine plus pyrimethamine. We combine those two. We combine those two. That's what we generally we mention. So that's all. That's all about this part. That's all. Next, which of the following drugs are used in the treatment of scabies? Which of the following drugs are used in the treatment of scabies in children? So here we don't use ivermectin. We don't use ivermectin. Oral, typically oral part we don't use. So predominantly we can use permethrin. It is a first line drug. Next one, protamidone, 10%. And of course, it is not that effective. It is less effective than permethrin. But again, this is a multiple answer question. We can go for these two. We can go for these two part. So permethrin and clotamethrin. Yes, exactly. No, not benzyl benzoate. Benzyl benzoate 25%. This is a percent. I still remember the percentages to permethrin 5%, clotamethrin 10%, benzyl 25, which is a very high percentage. Very high percentage. We don't use it. We don't use. We don't use. So permethrin and clotamethrin. These are the two. In infants, they have given. Okay, fine. Okay, I'll correct with this. Infants. Fine. Thank you. Infants. We use go for topical treatment. We don't go for oral part. Oral part. They ask for in infants. Okay. Thank you. Next one. Which of the following is a correct statement about a GnRH antagonist? Again, this is a direct question from our notes. This is what I mentioned in the notes. GnRH antagonist release. I told you this is again a previous year question. So to prevent this premature ovulation and used in the treatment of prostate cancer. So short acting and long acting. Again, this is a multiple part. So A and B. A and B, these are the correct answers here. We don't use it for this hypogonadism. Why we use this one for hypogonadism? So that's all about this GnRH part. That's all. Now let's go to the next part. Which of the following recognized adverse effects of topical? He asked it clearly, he mentioned topical corticosteroids, So hirsutism, no. Hirsutism, of course, we it is like increased what we call hair growth, but it is not due to topical, but it is due to systemic corticosteroids. It is due to systemic corticosteroids. It is like skin atrophy, and it's not hyperpigmentation, skin atrophy, hypopigmentation. These are the things we will see. We will not see hyperpigmentation. We will not see hyperpigmentation. We will not see hirsutism. Can anyone remember like what is the fourth option about this part? I'm not sure whether it's a multiple answer question or like a, individual one. But the skin atrophy, this is what answer. Bluegrass, that's what. No, it's not hyperpigmentation. It's not. It causes hyperpigmentation. Classically associated with hyperpigmentation. Hypertrichosis. Yeah. That's what I can remember these three. So skin atrophy will be the answer there. Skin atrophy will be the answer. Hirsutism, it's due to what you call systemic one. It's not due to topical. Multiple choice. Okay, then what might be the fourth one then? What is the fourth option then? They gave hirsutism and hypertrichosis. Okay. It's like acne, yeah. Acne. It's prone to acne, true. That is also might be the correct answer. If it is like multiple one, then we go for skin atrophy and acne. Not definitely hirsutism, not definitely hyperpigmentation. Hirsutism, hyperpigmentation are not the options. That I can tell. So, so that's all. That's all about this topical corticosteroids use. This is what again we mentioned. Clearly, we mentioned our notes like a topical application, cutaneous arthritis. Clearly, we mentioned. Clearly, it is there. And here we have like a hirsutism too. Increased hair, that is female hirsutism. It's not due to topical, it is systemic one. It is due to systemic one. Again, the next one, this, as always tell in the class, this in diabetes, if he concentrate on endocrinology, definitely he's going to concentrate on diabetes. In diabetes, SGLT2 inhibitors are the like top class drugs. He definitely from the past, I think from four exams, 4 or 5 exams, almost every exam, one question will be there from diabetes or SGLT2 inhibitors. So here, as we already spoke about these anti-diabetic drugs, this SGLT2 inhibitors part. So diabetes, some heart issues, which drug is used to what you call reduce the complications? SGLT2 inhibitors. Yes. SGLT2 inhibitors part. So diabetes, heart failure. What drug is indicated based on the given information? SGLT2 inhibitors. He didn't give what you call like typically drug name, which I think he mentioned only group name SGLT2, right? He didn't give. So this what about SGLT2 part. That's what clearly we mentioned here. SGLT2 inhibitors, gliflozins, clearly we mentioned in the notes. Again, it's a direct question from the notes. Direct question from the notes. So again, what thalidomide? What are the true statements about thalidomide? It is used in erythema nodosum leprosum, that is type 2 lepra reaction. Yes. It is used in multiple myeloma. Yes. It is a teratogenic. Yes. It is not an. It is anti. No. It is not an antimetabolite. It is not an antimetabolite. So one is used in type 2 lepra reaction, multiple myeloma, teratogenic drug. These three are the correct options. These three are the correct options. So clearly we mentioned here also thalidomide used in the treatment of multiple myeloma and lepra reactions. Most effective drug, if most effective drug for a rapid effect, again the thalidomide. And as we mentioned, teratogenic drugs, thalidomide. So clearly those three were from our direct notes, from direct notes. So again, one question about bempedoic acid. So this one, even if you don't what you call know about this part, will it inhibit HMG5 reductase? No. Statins. Statins inhibit that one. So this is not a correct option. It is going to inhibit ATP citrate lyase and it is used as an adjuvant drug. That's true. And of course, it is a dicarboxylic acid derivative. These three are the correct options. I don't know whether he asked a true statement or a false statement. If it is a true statement, these three will be the correct answers. And if it is a false statement, this will be the correct answer. I'm not sure whether they asked a true or false, but I'm pretty sure these are the four options. These are the four options which they have asked in the exam. That's all about this question. And again, erythropoietin analog, true regarding this erythropoietin analog. Again, this is directly from our notes, used in CKD and used in drug-induced anemia. So, used in anemia due to CKD. Why we use for nutritional deficiency anemia? We don't use. And of course, it has like a off-label use. It's not a FDA approved. It is an off-label use. Off-label use. This also will be the correct answer. I am not sure whether competitive inhibitor was mentioned. So competitive inhibitor of what ma? That's fine. So here erythropoietin unlock this anemia of chronic disease, like single best option, anemia of chronic disease. But if they ask you like a multiple thing, we can go for this myelodysplastic syndrome. But I'm not sure. He has given these three options, but is it like a single best option or like a multiple one? I'm not sure actually, but if it is multiple, you can go for two. But if it is a single one, go for this. Go for this. So that's all about this erythropoietin analogs question. So again, that is it from direct from our notes. Direct from our notes. That's all. That's all about what you call majority of the questions asked for bempedoic acid. Okay, fine. So that's all about questions asked in pharmacology part. But if there are still any other questions, just you can just text me. You can just text me if there are any other questions or if there are like slight errors in the options or in the question framing part, or if maybe if I left any questions, something, you can just text me, Sudheer Prudhvi, to my Instagram ID. I have scored most of the formal times for 4 days class. Thank you, Arun. Thank you so much. Thank you so much, Arun. That's great. That's happy to hear. I'm very happy to hear that you scored maximum marks in pharmacology. Very happy to hear. Yes, I still remember like you are the one from past like 4 days, 3 days consecutively you got like a top in the leaderboard. On the fourth today, I think second, I think so. I still remember you. I still remember sitting on the first row. I remember you. That's great, Arun. Happy to hear. So continue the scene. Continue the scene. Still, if any other questions, you can just let me know in the chat box. Mm, Still, thank you, Ma. Thank you so much. Thank you so much. Just see again, like major, as I always tell in the class, like a majority of the questions were there from our notes. Majority of the questions, one question from IUCD. Okay, I think it's from copper IUCD. I think it's like day when we have to insert that part, like when you have to insert that IUCD fourth today. There's more. That's more about ops scanning. Yeah, that's why. That's why. Yeah, it's more about ops scanning. Like for fifth day, I remember that question. I remember that question, but I thought it like that dealt by ops scanning faculty. The workbooks. That's what I always mention. Read workbook. Read a single source, a multiple revision. Single source, multiple revision. That is more than enough. Just to see from our workbook, almost I can tell 90% of the questions were direct ditto from our workbook. Exact lines which I told. So concentrate more on workbook, single source, do multiple revisions, do multiple, don't go for multiple sources. One source is more than enough if you do multiple revisions. Still, any other questions left? If you can tell. I think there is one question on like it's about schedule, I think so. If you can recall that part, but I'm not sure about the options, but I can tell morphine, it is like schedule X that I can tell. Morphine schedule X part. There's one question about schedules and the insulin schedule G. Insulin like schedule G. So, so these are the two things I think so. Schedule, yes, yes, only one option has it. Yeah, that's it. Morphine and insulin schedule. I think these are the two. Based on this, you can just come to a conclusion. So that's all. Drugs for veterinary use. Oh, they are drugs for veterinary use. Okay. Hepatitis B vaccine. Hepatitis B vaccine. It's like comes under Schedule C. Vaccines comes under Schedule C. Vaccines comes under Schedule C. Majority of the vaccines, all the biologicals, these are all biologicals. Biologicals comes under Schedule C. Veterinary drug. I'm not sure about that. What is the thing schedule they have given? But this is what I can recall this part, this thing. I think it's from match the following, I think so. So maybe with this schedule H, which one? Schedule G. So they didn't give, uh, if they give schedule J, okay, or you can go for schedule H. Anything is fine based on the option they have given. But typically speaking, it comes under schedule G part, but that's fine. Okay. Schedule C not there. Oh, Z. Oh, oh. Then I'll just cross-check that one and I will update in the group ma. So yeah, these kind of questions, if I miss anything, such kind of questions, please text me. So if I miss anything or like if options were like not that, like I think majority of the questions were like almost correct. But if there are these kind of few things, just text me, let me know. Text in my Instagram. I'll go through and I will correct them, and maybe by tomorrow we'll upload all the what you call 100% accurate kind of questions. Okay, fine, fine, fine. I'll just go through that one. I'll just go through. So that's all. So that's all about our pharmacology recall session. So these are all the questions again, like majority of the questions directly from our notes. So concentrate on the notes. Still, you have like a NEET in the coming 30 days. Focus more on NEET. Don't get deviated. Just focus more on NEET from today or like from tomorrow morning. Just concentrate on NEET exam. Don't get deviated. Don't get distracted with all these things happening like post exam analysis. All these things. Don't get distracted. Just go through this analysis part and that's it. Leave it and start preparing for NEET. Don't waste time. So that's all. Thank you, ma. Thank you, Kavya. So that's all then. That's all about pharmacology things. Uh, so if anything is left, just text me. Thank you all. Thank you all then. Uh, we'll wind up the session. Thank you all.